I'm going to give you an example of why nursing school questions are so hard to answer. And it's going to be on the topic of pernicious anemia, usually studied in your hematology unit of MedSurg, if you're curious. Before I give you the specific example, you've got to know a few general basic guidelines about nursing school questions and how they're written. They're written at a higher level of difficulty than you're used to, which means that even though you're used to seeing multiple choice questions, it's not just recall recognition. Straight up memorization works really well for recall recognition, which is why memorizing when you study has worked so well for classes before nursing school, because when they write multiple choice questions, they're at those lower difficulty levels. You either know it or you don't. Obviously, if you're watching this, you know when you get to nursing school, it's not like that anymore. You can do all the studying and still get a question that you're like, I don't know this, I didn't study this. That's because nursing school questions are written at the application analysis level. This means that the questions being asked is not a simple one-to-one correspondence of information. Instead, it's something you have to either apply some knowledge that you already have to the situation they give you in the test question, or you have to take the information in the test question and analyze it based on some information you have in your head. In either situation, it requires you to have some knowledge in your head and to combine it with the information in the question. This is what we mean when we tell nursing students you need to develop your clinical judgment, your critical thinking, your how to think like a nurse skill. It's how I teach students to think through the information using my silver bullet study system. Make sure to give me a follow and you can get a free 10-minute video of the silver bullet study system if you go to my profile link, by the way. So here's an example of an application analysis level question. One of my one-on-one tutoring students brought this to me and we discussed it in one of her recent tutoring sessions. And obviously I don't have the question right in front of me, but the gist of it was saying that the patient has a diagnosis of pernicious anemia, and then it says, which of the following symptoms would you expect this patient might have? And then it listed out 4 different symptoms. So it's tempting in that situation to think, oh, I should have memorized all the symptoms of pernicious anemia. Don't you dare do that. You gotta use your logic in order to figure it out. Basically develop your own rationale. And so we went through the answer choices one by one. And you can use the 4 steps of the silver bullet study system to plug things in when you do this, which I did with her. So we went through the answer choices one at a time. One of the answer choices was, you might expect to see an elevated hematocrit and hemoglobin. So I asked her, if we saw that, what would we expect was going on in the body? What would that tell us about what's going on in the body? And she's like, well, it would mean that we have elevated red blood cells. We have too many red blood cells. And I said, is that what you would expect in pernicious anemia? And of course she's like, no, because anemia is low red blood cells. Pernicious anemia specifically, by the way, is body has difficulty making enough red blood cells because of a lack of intrinsic factor. And the intrinsic factor in the body helps with the vitamin B12 absorption. And then all of that kind of leads to this cascade where the body doesn't have the ingredients it needs to make red blood cells. So I was like, okay, so we don't expect you to have an elevated hematocrit or hemoglobin because that would be the opposite of anemia. Another one was having a ruddy complexion. So the redness in your cheeks and so on. I said, when might you expect that? And she said, well, when you have a lot of red blood cells and you're very well oxygenated and it's maybe too much, maybe even polycythemia, which is the opposite of anemia, but not for anemia. For anemia, you'd expect to be pale because you're not having enough of the red blood cells. So it can't be that answer choice. And I forget the third one, but the 4th answer choice, numbness and tingling in the extremities. And she's like, that's a symptom of B12 deficiency, but it doesn't list it as a specific symptom of pernicious. And we were like, oh, well, isn't that interesting? If you have pernicious anemia, you have a lack of intrinsic factor, which leads to an inability to absorb vitamin B12. What's going to happen next? Well, you're not going to have enough vitamin B12, right? You're going to have a vitamin B12 deficiency. So would it make sense that then you would see the symptoms of vitamin B12 deficiency in somebody who has pernicious anemia? Of course, the answer is yes. Now, the better you get at thinking like a nurse, the faster this thought process goes. When I'm explaining this to you, it took a couple of minutes. But when you're studying and practicing using the silver bullet study system in your study time routinely, then your brain just flies through all of these possibilities and creates these rationales on the spot, because you've developed your clinical judgment and you're going to start getting your test questions correct a lot more often. Again, if you want to learn the silver bullet study system, I've got classes. I support people in my group tutoring membership to learn it. And I also do one-on-one tutoring sessions about it. But just start with my freebie. I have a free 10-minute video that you can find in my bio link, and just put your email address in and I'll send it to you.